Welcome to the Mom and Mind podcast. I'm your host, Dr. Kat, and on this episode, I am joined by Shatiera Amankrah. She is a licensed therapist specializing in infertility counseling and certified in perinatal mental health. She shares some really important parts of her journey and also the journey with her husband in this process that I think really is not talked about enough. And she also shares how she's now helping other professionals learn more about how to support people going through infertility. Her private practice, Seeds of Hope LLC, provides a range of services with individual therapy, surrogacy screenings, donor egg and sperm screenings and consultations, workshops and trainings for professionals, clinical supervision, consultation, and she is licensed to practice in Virginia, Georgia, and Washington, D.C. She has some trainings coming up that I'll tell you about at the end of our chat. So let's meet Shatiera. Welcome, Shatiera. Thank you so much for being here.
Thank you. Thank you for having me.
I really appreciate that you wanted to come on and specifically talk about infertility. As you know very well, it's a discussion that not enough people are having, and it's also really um, can be confusing, can be a long journey, it could be a short journey, it could be a million different things. So I'm grateful that you want to share your experience and some of your personal journey and your professional experience as well.
Yes, thank you. It definitely is a roller coaster
Mm,
with lots of different variables in terms of outcomes for this particular thing. Yeah.
yeah, for sure. So for now, yeah, just start wherever you're comfortable with, wherever you'd like to with your own journey.
Okay, sure. Um, so I got married, and once I got married, I was actually in graduate school.
Mm,
And when I was in graduate school, when I first got married, my I started on birth control,
mm,
and I had really bad side effects from it, so I discontinued it. And my husband and I talked, and we were kind of like, if it's our time, it's our time. If we get pregnant, we get pregnant. If not, like it's fine. And so I was like, all right. Uh, so after a few months, like we didn't get pregnant. And so then I kind of started to then kind of change my tune a little bit, even though I was in
mhm.
grad school, and felt like, well, maybe I wanted this more than I realized.
Right.
So I started kind of tracking and monitoring. And after some time of that, just not having success, my husband and I both kind of started to research. And I was getting closer to finishing my graduate program. And during my graduate program, I had, as soon as you get married, even before you get married, when you get engaged, everyone is kind of like, when are the babies coming?
Right, right.
um, and like our family, especially our community, especially like laid it on thick. What are you doing? What's the plan? And I was able to kind of use grad school as like a shield for a while to be like, oh,
Mhm,
I'm in grad school. Even though like, during much of that time, I desperately did want a child. But I kind of was able to kind of cover it up a little bit in that way.
mhm,
So as it started inching closer to the end of grad school, myself and my husband started researching a little bit more about infertility and how to get pregnant and what could be going on. Um, and then my husband um, came to me and said, "Hey, like I was doing some research, and I remember that when I was young, like I was born with this medical issue, and I actually had surgery when I was a baby or like a
oh.
toddler." And I was like, "What? Huh?
Surprise.
Like what?" And so
Uh-huh.
I said he had undescended testes,
Uh-huh.
and that can impact male infertility. And he
Mm,
had forgotten. So I was like, well, how is that something that you forgot to mention all this time?
uh-huh.
But after, he kind of realized that and I did a little bit more research on it, we kind of just said, okay, like let's go straight to the fertility clinic.
Mm,
Before
mhm,
that, I had been working with my regular OBGYN and doing some other like low intense treatment options like
mm,
timed intercourse and
mhm,
Clomid, and none of that was successful either. So after my husband remembered his situation, we went to the reproductive endocrinologist.
Uh-huh.
And in fact, when we first did all of our testing there, they first diagnosed us with unexplained infertility.
Mm,
All of his numbers looked fine, everything was great, my stuff was great, and so we were kind of like, wow.
mhm,
And from there, they recommended, least invasive. We wanted least invasive since it was unexplained. So we had already tried like timed intercourse and some of those things. So we started with the IUIs.
mhm,
Um, and the first one didn't take. The second one, as we were doing them, we did about five. I can't remember honestly if it was five or six, but we did about five or six. And after like the second and third and fourth one, my husband's count started going down for each sample that he provided for the IUI,
mm,
and it wasn't like the first time. It was like just on the cusp of like what's considered normal, the
mm,
range from normal. It was like right at the cusp of normal or abnormal. And so they were like, oh, okay, well, maybe he was sick or, whatever. So that's just, whatever. And then the second time it was a little bit lower than that. And then the third time it was just like, okay, like this is actually looking like it's a concern.
mm,
So
mm,
he started working with the urologist and did some further testing and everything. And then that's when we got like the devastating news of like, hey, we think the best option moving forward is IVF.
mm,
Um, and I say devastating because we were doing IUIs and at the time those were covered by insurance.
mm.
And
Right.
IVF was not.
Wow.
And we were still young. We were young into our careers. When I say young, I
Right.
mean in our careers. We didn't have a lot of money.
Right.
We had just bought our house, and so we were strapped. And so, it was very difficult to kind of accept that like this is the best option, and it's
Right.
going to cost a lot of money.
Right. Right.
Um, so ultimately, though, we did move forward with IVF because it was just it felt like the only option.
Mhm,
And what the doctors were saying was our best option.
mhm.
So we, depleted our savings account and had to take out an additional personal loan. It ended up costing about 30, excuse me, about $30,000.
Mhm.
So again, young professionals,
Right.
just newly into our career, it was just it was a lot.
Well, of course,
Um,
yeah, that is.
so, so we did move forward, and as we were doing the IVF cycles, um, we the first one was unsuccessful,
Mhm.
which was really heartbreaking because at the time it felt like I was devastated to learn that we had to move forward with IVF because of the financial aspect,
Right.
and at the same time, once I got into the acceptance phase of that, it was exciting because it was just like, okay, so now we have this new diagnosis, we have an
Mhm.
option, like this is gonna like get us these results, we're gonna get a baby.
Right.
And that just wasn't the case either. And they were like, oh yeah, you guys are great candidates, you're gonna do well.
So, like,
And
even like retrieval went well.
well, no, actually.
Oh, oh,
Well,
okay.
technically it went well because we were able to get a few embryos, but I remember during that time, they had anticipated that like my retrieval would be, I think, better for lack of a better term. Like it would yield greater results than what it did.
Mm,
And I remember mid cycle having to change medications after going in for monitoring and them seeing that like my body wasn't doing what they had anticipated it
mm,
would.
mhm.
So I just remember like going like, driving far distances, calling, because you can't get these meds at your
Right.
local CVS.
Right. Right.
So having to jump through hoops because it's just like, oh, like you need more medications and you need to start taking this today.
Oh, mm,
And it was a weekend and it's just like things aren't open. So it was just
right.
a really like it was a lot. And even then, I think we got about 11 eggs retrieved.
Mhm.
And again, we had anticipated more, but we didn't. And with that 11, we had about five, I think, that fertilized properly and went to blast. And then four that like froze properly.
Uh-huh.
And then we had our first transfer was a failure or not successful. Our
Mhm.
second transfer was unsuccessful. And then finally, third time was the charm for us.
Mhm.
We got pregnant for the first time ever with my daughter, who's now 8.
Oh.
Um, so
Mhm.
that was amazing. And then we had one embryo
Mhm.
remaining.
Mhm.
And this was before gender selection was a real thing and a real option. So we had
Mhm.
no idea what it was at the time of the retrieval. But I remember once we had my daughter, a lot of people are in my ear like, "Oh, hey, once you get pregnant, you're extra fertile." So, and we were
Oh
just
my
like, "Okay,
gosh.
well, let's take advantage of this and like let's just, try to get pregnant even though, we just had a baby, but like if it means like we can save money, let's do it." And so we did try, and of course, by the time my daughter turned 1, we had not been successful on our own. So
Mhm.
we went back to the drawing board, and we had the one remaining embryo. And we were kind of like, do we just go forward with this embryo? Do we just do another cycle? Because last time it took a
Mhm.
few shots, like,
Mhm.
and just financially, we were trying to figure out what was the best financial option. Um, and we were kind of considering, sorry, not gender selection, but sex selection.
Mhm.
And we were just kind of like, I was kind of like, well, if we got to pay all this money, maybe we should. So it was just something that just like, ethically and morally, we're kind of just like circling, like, do we really want to do
Mhm.
this? Like, is that, something we really want to consider and, try to like force or, um, we didn't end up, doing it because we ended up finding out that the cost for the embryo transfer was significantly lower than we had anticipated. We thought it
Okay.
was going to cost similar to the 30,000 that we had spent at first, and it was not even close to that. So
Mhm.
we were like, "Oh, okay, well this is worth the risk of just
Right.
trying." And thankfully, it did work. So we got pregnant with my son, who's now 5,
Mhm.
and he'll be 6 in a couple months.
Okay.
And and so once we got pregnant with him, then we didn't have any remaining embryo, which was also, I just say like a blessing in disguise because we didn't know it at the time or realize it or think about it at the time. But, having to kind of figure out what we want to do with remaining embryos and dispose, discard, adopt, I mean, not adopt, donate, like, all of those things. Thankfully, we weren't in that position.
Right.
Um, so that's kind of like where things went with us for how like we came to build our family.
And so what was that kind of time span from when you guys first started trying to when you, I guess, became pregnant with your daughter?
Total, it was about 4 years from the time we got married until the time my daughter was born.
Hmm. Okay. So, I mean that's a long time. I mean, it can feel it can feel like even extra long, right?
Yeah,
With
yeah.
that ups and downs and all arounds.
It's funny because now as I am, working in this field and so like on the other side of things, I've
Hmm.
become an advocate and speaking out and sharing my story and talking to so many people and hearing so many stories of people, on this journey for, 5 years, 10 years, 15 years.
Yeah.
And there's many times where I had started to feel like, oh my gosh, like, did like I was here, I was, stressed out and I only, went through this for a few years.
Hmm.
Um, and then I kind of really do remind myself that like my journey is my journey, and just
Right.
because it was shorter than others doesn't mean it wasn't as painful.
Right.
And in fact, it was. It was just like emotionally draining, and it felt like a decade. um,
Sure.
every single month, negative pregnancy test after negative pregnancy test,
Hmm.
all this excitement and hope, crashing down with my period starting or getting a negative pregnancy test and
Right.
friends and family making comments and asking about things. And like it definitely was a huge emotional, barrier, not barrier, but like roller coaster
Yeah.
that I went through during that time.
Right. I mean, to what you were saying before, like waiting and watching every month, that makes time go slow too. Just
Very
like you're
much.
watching the clock all the time.
Yeah. And you
Um,
kind of put your life on hold.
mhm.
Like friends had invited me to various vacations and trips and things, and I'm like, nope, can't do that because I'm hoping I'm going to be pregnant next month. Nope,
Mhm.
can't do that because 2 months from now, yeah, I'm going to be pregnant at that point, and I don't know if I'm going to be experiencing morning sickness or what. So like, can't do that. It just feels like, things are on hold. Can't do anything. At the time, Zika was around and a thing, and
Oh my gosh, right.
so it was like scared to go outside because it's like
Mhm.
I'm trying to get pregnant. I don't want anything. Once I get pregnant, I don't want anything
Mhm.
to, impact this pregnancy. And so yeah, it was definitely a journey.
Right. So just in terms of the time, I appreciate you saying that too, that like your journey is your journey. I mean, comparing yourself or anybody, to anybody else, it doesn't help anybody, and it's all really quite relative. Um, but like, yeah, like you said earlier too, there's so many different experiences and ways that people come to pregnancy and lengths of time that, I mean, you can't compare things anyways.
Hmm. Hmm.
Just so many different
Yeah.
factors.
One of the things I like, I think it's very easy to say you can't compare things, and I agree 1000% that it's really difficult to compare. And it's not helpful because usually you're not comparing apples to apples here
Right.
on this journey. But one of the things I do especially talk to my clients about, because I think that as someone who's been through this experience, it's just also a little bit sometimes unreasonable not to compare.
Mm.
Because I mean, it's kind of also like something that just our society like just does, and culture is just
Right.
so compare and contrast, and you look at statistics and like it's like, oh, okay, like. And so one of the things I really emphasize to people, is when comparing, because at
Mhm.
some point you will, um,
Right.
just
Right.
try to remind yourself that like your experience isn't better or worse, but just exchange that word with different.
Hmm.
That
Hmm.
yes, this person was on, experienced infertility, their journey was different than mine, or their
Right.
protocol was different than mine, their egg
Right.
retrieval was different. Instead of like, oh my God, they got so many eggs and I didn't get any. It's just, they got a different amount of eggs than what I.
Hmm.
And so like it kind of helps to provide some balance where it's just like realistically I'm going to compare, but at least like my mind frame, I can kind of just remind myself that it's not better or worse or greater or less. It's
Right.
really just different.
Right. That's such an important point. Um, for so many reasons, but for mental health wise, that that like feeling less than kind of feeling, or no, I'm not as, however it shakes out for you internally, it often becomes some way that you're hard on yourself too, um,
Yeah, definitely.
to like the kind of what's wrong with me, why can't I, kind of feeling. And I'm not saying that people are saying that in like a self-pitying way, but just like a, I want this child so much, and why is this so hard?
Oh yeah, absolutely. I mean, there's a lot of self-blame. Like
Mhm.
you think like, what is my body not doing right? What did I do to contribute to this? A lot of times people are like, oh my God, I was on birth control since I was a teenager and this is what's contributing. And oh my gosh, I ate this. And, you just start like, with grief and loss, it's like you're just trying to find answers. You're trying to make something make sense. And so you definitely go through a phase of like blaming yourself, questioning what your body is doing wrong. What did you do to, make this happen and to contribute to this experience? Um,
Right, and you're already in, so much emotional pain, or at least mental anguish of just trying to get to the baby that you want to have, and then also you got to go through all these hurdles of what's happening for you internally. It's so much.
yeah, yeah. Um, and I think like the outside noise from your loved ones really plays a role,
Mm.
because this journey can be, for me, anyways, and many others, it is very isolating. And being in this space now, it is really unique because I feel like I hear so many people. It feels like so many people talk about this and it's so out there and things are changing and like there's not as much
Right,
shame and stigma around it.
right.
And I have to remind myself that like that's not actually the reality. That's just because I have put myself into this space and put myself into these circles where I'm experiencing all of this.
Yeah,
But the reality is I have still a lot of family, a lot of friends, a lot of people who reach out to me privately who are just like, no way could I ever talk about this. No way am I sharing this story with others. This is my story alone, which I of course respect.
right.
Um, but it does remind me that like it can be a very lonely journey, and isolating. And for me, it was for a while. My husband was very much like, let's not tell anybody about this.
Mhm.
Um, and at first I was, I was just newly married, so I was trying to respect my husband and my marriage, and I was like, okay. And eventually it became too much, and emotionally, and my husband saw like he's not a talker, and he understood at some point that like this is what I need to help me
Oh,
emotionally.
right, right,
And so he was eventually like, okay, like I think it'll be okay if, you share it with, a few people.
right.
And over time, like now, I hear him talking about it to
Nice.
people, and it's just amazing to see even him as a Black man who, talking about his feelings and his emotions and the difficult time he went through
Mhm.
while, we were navigating this journey as well. So it's amazing to see where we both have come.
That's
But
cool.
when we were in the trenches, it was absolutely tough.
Yeah, I mean, I obviously I don't know your husband, and I'm not asking you to speak on his behalf, but oh, well, and um, I just in general, I think there's so much pressure on men to sort of be virile and, you know, spread your seed and like all of these messages that men have to contend with in a way that women don't. Women deal with something different. But I imagine that's also silencing, um, to not to feel like you can't even talk about it because of whatever people will say.
Yeah, I mean, I think I agree 100% that it's tough because it's just like, oh, like who wants to, when you think about like, you know, being a man and feeling like, oh, it's my job to kind of get this sperm going and
Hmm.
reproduce. And it's
Hmm.
like, and especially I think for folks who are navigating male infertility, male factor infertility, it's like, oh, this is my fault.
Hmm.
I'm the reason why my partner can't get pregnant.
Hmm.
And I think that that can really play a part in kind of feeling more shame,
Right,
and more like alone and like I'm not talking about this with anybody.
right,
Um,
right,
but
and right. I mean, that's already so hard. If, anyways, to not feel like you can talk about it, but man, I mean, there's so much pressure, right? Just you were talking about even people who love you and care about you a lot and that you love and care about a lot, it's still, it doesn't mean that people will really get it.
oh yeah, oh yeah, like you know, people don't often get it. I mean, some of the craziest things that have been said to me, or most bizarre things, people just they don't know.
Hmm.
And I've had friends say, oh, if you just, do have sex in this particular position, like
Uh-huh.
that's gonna get you pregnant and you're gonna get a boy. And like
Oh.
when I say that they're saying these things, not
Hmm.
like as a joke and like in jest of like, yeah, 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 just do this position, but like with seriousness, like, oh, like I got pregnant this way, like just
Right,
do this and like it's gonna help you.
right,
And I'm
right.
like, smiling like,
Hmm.
like,
Hmm.
if only you knew, and like, if only it was that simple, like we'd all
Oh,
be having
right.
babies, right?
Right, right,
Like,
right,
there wouldn't be such thing as infertility because we could just get into this position and keep our legs up, and
right,
we'd be pregnant.
right.
Um, and people, definitely give credit for well-intentioned people, and like
Mm-hmm.
they love us and they care about us, but it's like, you also just don't realize what people are going through
Right.
and where they are in their journey, and just, saying things that you don't think might be hurtful, but that are really hurtful,
Hmm.
and can really kind of hit you right in the gut.
right. And it's sucks because you are the person who's experiencing going through the journey. You then have a choice to make. If people are saying things to you, like, do you say something to them about it? Do you say nothing and just try and like preserve the relationship you have? Now you got to like manage other people's feelings about what you're going through, and oh my gosh, it's too much.
Yeah. Yeah. It's a lot of boundary setting.
Mm,
And I think that one of the things that I talk to my clients now about even is having a few different kind of prepared responses
mm,
when you're on this journey. And some can be a little bit more reserved, like, I said a lot of times, especially within my church community and for, at different events that I would go to and people would be asking me, I just say kind of like, just pray for us, whenever,
mhm,
just asking you to pray for us. And then other times, like, depending on the situation and the circumstance and the relationship, I might have a little bit more of a sassy response and say, like, mind your own uterus. I'll worry about mine and you worry about yours.
oh, I love it.
um,
Right,
but just
right.
truly having prepared responses because, like, it's gonna happen, it's gonna come up because just the society and culture we live in is this is if you don't have children and your partner, this is a just common topic of
Mhm,
small talk.
mhm.
And so just being able to kind of be prepared with how do I want to answer this? How do I want to respond to this? And sometimes you may say, hey, like, I don't want to talk about this. And other times you may like be like, let me spill everything.
Right.
And just kind of going and honoring whatever you're feeling in that moment.
That's a really good rule of them to that, right, that it doesn't have to be one thing all the time.
Oh yeah.
Because, right, I mean, I assume you have different feelings at different times about it, depending
Yeah.
on a million different factors. But there could be days that you really feel like talking about it, other days you just want to talk about the weather.
Absolutely. And different people, right? So some people that I'm closer to that maybe, I don't want to, feel like I'm being, distant. And then others who I'm like, I barely know you. Like, why are
Mhm.
you asking me about this? Um,
Right,
and so some of those
right.
relationships I care to preserve and others I just don't. Or there's people like my grandma who is like, when you gonna have those grandbabies? I need those great grands. And I'm like, I'm working on it, grandma.
Right.
um, and interestingly enough, when I did finally talk to my grandma about my journey and told her like, hey, like, we're going through IVF and like we're trying, I desperately want to, because she would make comments like, I don't know how much time I have left. And
Right,
I was
right.
like, Grandma. Um, but when I finally told her, she was kind of like, oh, your cousin went through this. And I was like,
Hmm.
what?
All
Grandma
the
knows
family
all the
stories.
secrets. And I was like, what do you mean? And I immediately called my cousin and I'm like, hey, like
Uh-huh.
you're going through IVF or you went through IVF? And you're like, yeah. And I was like, I had no idea. And
Right.
so it just kind of really did bridge that relationship and that conversation
Mhm,
where, even your closest family members that you may not know are going through this.
mhm.
And so I've noticed that the more I open up and talk about my experience, I found so many people who I knew in my personal life that were also going through infertility. Um,
Right. So it's all of these people that you know are silently going through their own stuff. That's like the
Absolutely.
isolation and feeling alone part. It's
Yeah,
so tough, right? I mean, to know that somebody you care about was suffering silently.
yeah,
Um,
yeah. Is really tough, and I found that like when I did start talking about it, even in casual situations with some of my closer friends, like they're kind of like, oh crap, like I had no idea, and like they're running through all the things that they've said and times that they've made
oh,
comments maybe, and I'm kind of just like, I totally understand. Like I said, I know it's not,
mhm,
it's hurtful, yes, and I know it's not. That's not the intention.
right.
And most of the people in my life personally had once I shared had been extremely supportive and
Hmm.
fortunately I didn't have any experiences where people were saying hateful things after I opened up and talked about it.
Yeah, yeah.
But I do have clients who family. they have certain belief systems, and it's just they're not
Mhm.
as supportive, they're
Mhm.
not as understanding.
Right.
And that's, even tougher to feel like, vulnerable enough to open up and share, and then be met with, lack of support.
Right. Right. Um, that's so hard. It leaves you with fewer places to turn, um,
Yeah.
for sure.
So one other thing that I think um, was important and unique, um, well, I won't necessarily say unique about my journey because it is common, but something important that I don't think a lot of times folks necessarily realize is pregnancy, the experience of pregnancy and postpartum
Mhm.
after a journey of infertility.
Mhm.
And that was uniquely, for me, uniquely challenging
Mhm.
because with my first child, my daughter, I experienced really bad morning sickness.
Mm.
And um, I like to say now I have self-diagnosed hyperemesis,
Mhm.
but I know that it was not to the extent that folks who actually have that diagnosis experience, but for because it was only for a few months. But those
Mm.
few months, those first few months of pregnancy were rough. I missed so much work. I
Mhm.
was constantly in the bathroom vomiting.
Mm.
Couldn't like it was just a terrible experience.
Mhm.
And I just remember so many times while I was leaned over the toilet, questioning myself, why did I do this to myself?
Mm.
I paid all of this money, went through
Mhm.
all of this treatment and these
Mhm.
injections and all of this stress to get pregnant, to experience this. Like,
Mhm. Mhm.
why did I put myself through this? It's just like I started feeling like, is this like, because I didn't do this the quote unquote natural way? Is it because I
Oh.
did IVF and this is, God's way of punishing me by
Mhm.
making me, having morning sickness? And I was really anxious because I had never, fortunately, I had not had any miscarriages, so I had never had any losses, but this was my first time ever being pregnant.
Mhm.
And I will never forget the day that I found out, of
Mhm.
course, and saw that very, very, very faint pregnancy line
Mhm.
and just cried and jumped for joy and excitement. And that lasted, a day. And then it became very anxiety provoking because
Mhm.
you get that pregnancy test, you're so excited. I've never seen this before a day in my life. And then it's like, okay, but now I have to like go back in 2 days later to make sure that my numbers are going the right direction and that I'm not
Mhm.
going to miscarry or have an ectopic pregnancy. You go
Mhm.
back in those 2 days and then they want you to come back in 2 more days and they want you to come back in another week. And there's constant monitoring,
Right.
which is also appreciated because it's just like, I want to make sure things are going right. It's
Yeah.
reassuring.
Right.
But at some, but that reassurance kind of can quickly fade to going right back to that anxiety of what's next. What's next? Now I have to make it. The line keeps moving. You get to your 6 week
Right.
appointment, you graduate, and then you're like, oh, you just went through all of this, routine monitoring, ultrasounds regularly, blood work, all this stuff, working with this clinic for, years and months of like
Mhm.
constant communication, constant monitoring. And then you graduate to your OB clinic and they're like, okay, like we'll see you in 4 weeks.
Mm.
And you're like,
Wow.
huh? What?
Right.
No, but
Right.
I need to know like next week that my baby is still in here. Like I need to
Yeah.
know that like things are still going well.
Right.
So that's really anxiety provoking. I experienced a lot of anxiety, a lot of depression
Mhm.
because of just like the thoughts that I was having about like, do I deserve this baby? Like why
Mhm.
like this I'm having really bad morning sickness and my job had at the time had given me such a hard time trying to force me to use disability even though I didn't need to. And it was just it was just emotionally a lot as well. Um,
Yeah.
and then when I had my daughter, um, she was born in January, and so it was cold and flu season, and it
Right.
was
Right.
winter, and it was dark, and she was colicky, and I was just
Mhm.
like, I just remember again thinking like, I'm never going through this again. This is the last baby, the last pregnancy. Like,
Right.
what did I ask for this for? Why did I ask for this? Why did I want
Right.
this so bad? This is
Mhm.
not exciting. This is miserable.
Right.
I
Right. Right.
couldn't
Right.
wait till my husband got home. I couldn't wait to go back to work. People are
Mhm.
like, "Oh my gosh, I want to stay home with my baby." I'm like, "No, please.
Mhm.
When can I go back to work?" This
Mhm.
baby cries nonstop. It was so tough. Um, and eventually I worked through it by, like, building community and kind of
Mhm.
recognizing that I needed to get out and be social and,
Right.
take those risks that I was scared to take, like going out into, group settings. And I found some
That's a tough
breastfeeding
step.
support groups and
Yeah.
stuff like that, to just be in community with other people who were going through that, newborn stage at the same time as me. And I found those things to be really helpful. Um, and like
Right.
at the
That's
time
not
I had,
something like you're working so hard to get to have your baby. And I mean, it sounds in some way you feel like, okay, the hard part is over. And
yeah,
then no,
yeah,
no, it's not. Um,
yeah,
Not that everybody's journey is like your journey was, but it
very
almost, I
common.
don't know how else to describe it. Almost it does it feel like it's unfair in a way, or like this, you worked this hard, why is this happening to me?
Yeah, I was like, why does all the bad things have to happen to me? Like
Hmm.
I remember when we were talking about transferring embryos, and my husband, my mother, my mother-in-law, everybody wanted me to transfer 2 embryos. And at the time, it was an option. It's no longer really an option now unless there's medical indication. And I just kept saying, like, no, because when I finally get pregnant, I just want to enjoy my pregnancy. I don't want to have a high risk pregnancy.
Mm.
I'm a twin. So I was like, I don't know. Who knows? I might already get twins.
Right,
And
right.
like, they couldn't understand that. But ultimately, my body, my choices. So we
Hmm.
transferred one. But I thought, like, oh my gosh, I was trying to avoid having pregnancy complications and, all of these things. And I'm still like, why is all of this happening to me?
Hmm.
Like one
Hmm.
thing after another, just can't get anything to be like average experience.
Right.
And even at the time, I tried to find a therapist. And one of the most difficult parts about finding a therapist was, I talked to a few different people, and it was just like so much explaining the process of infertility and the procedures
Hmm.
and all of that stuff throughout my journey, that I ultimately ended up discontinuing therapy.
Hmm.
Um, and once I, got finally finished graduate school, got my license, I had completed my family at that point, and I was actually on maternity leave. I took my exam for my license on August like 1st or 2nd, and I had my son August 13th.
Whoa.
Yeah, so I was like 10 months
Tight
pregnant,
turnaround.
taking my exam. So on maternity leave, I started kind of thinking like, okay, what's next for my professional career?
Hmm.
And it was just like, duh, like this
Mm.
is your calling. This is where you need to
Yes.
pour into. So that's kind of how, this specialty really kind of found me.
That's great. And like where did you go to first for training? And or I mean, I know you've had um you've been working with infertility clients for a while, but right. So how did you get into it? I know a lot of therapists want to know how to work with folks going through infertility.
Yeah, so actually, when I was on leave, I was looking for a job, and I found a job advertisement for a perinatal therapist. At the time, I had no idea that that was even a thing. I was like,
Mm-hmm.
what? And as I was reading the job description, it said like must obtain certification, within 12 months or something. And I was like, certification? There's a certification for this? I had no idea. Like, it's so unfortunate that I had no idea that this was even a thing when I was going through it. So I applied, I interviewed, I did get the job. I started working as a perinatal therapist. I got the training through Postpartum Support International. I sat for the exam, I think a year or two later, or well, a few
Mm-hmm.
years after I took the training.
Mm-hmm.
Um, and then at the time I was working on student loan forgiveness. So my full-time job had to be government or nonprofit. And it was really hard to find a government or nonprofit job that was like focused around infertility
Mm-hmm.
specifically.
Mm-hmm.
So I kind of just in my various jobs, that I was working with various OB clinics and hospitals, I kind of just created my own little niche within the jobs I was in, and having a pocket of clients who were reproductive mental health, infertility, pregnancy, postpartum. And then during that time, I took a postgraduate course, a 10-month postgraduate course on infertility counseling. I connected with ASRM, the
Nice.
American Society for Reproductive Medicine. I took their training. They have a 3 course certificate. It's not a certification, but it's a certificate of attendance. I took their 3 classes. I got connected. I started attending the infertility conference in Philadelphia. So I started doing more research and reading. I have a couple of books, Reproductive Trauma with Janet Jaffe. Like I started just doing so much more research on my own as well.
Mm-hmm.
And it was very surprising to me how much I knew and how little I knew at the same time. It was just like,
Mm-hmm.
oh, we're talking about donors and surrogacy. That wasn't part of my journey. And
Mm-hmm.
so here I was originally thinking, like, oh, I can do this. I don't need any extra training. I have training as a therapist already, and I have my personal experience. And I just quickly realized, like, there is so many more layers to this reproductive
Mm-hmm.
mental health field.
Mm-hmm.
And so I was so grateful that I was able to get a ton more training on many different areas. So
Yeah.
that's been really helpful as well. And I'm also a member of Resolve, and they have a lot of information on their website as well.
But that's great. So the 10-month postgraduate course was from where? From through who?
That was through Sharon Covington. At the time, she was the medical director at one of the large fertility clinics in the area.
Mm-hmm.
And she's just a powerhouse in the infertility and reproductive world. She actually no longer does this course, but her daughter has taken it over. So Laura Covington, she is the one who now, she and someone else, I can't remember the other professional's name right now off my head. But they both do the Christy Costner, I think. They do the 10-month postgraduate course, and I think there's 2 different 10-month postgraduate courses, but the one I took specifically was with.
Mm-hmm. Yeah, I mean, it's you. Thanks for that. You mentioned a couple of things that are really interesting and that I totally agree with is when you go through your own personal experience, like you definitely get an education for sure. And but there are so many different experiences and the stuff. I just really appreciate you saying that, like the additional training was necessary. Because I mean, I'm sure
Yeah,
you've heard other stories too of people thinking they know. Um, they're and well-meaning therapists thinking that their personal experience is enough. And it's just there's so much more to learn. So, um,
yeah. And
yeah.
if I could just say also, like, I think that one of the things that I also noticed in my experience, personal professional experience, was that for perinatal therapists specifically, there's a few slides during the PSI trainings that talk about infertility. But PSI, that's not really their thing.
Mhm,
And so I noticed that there was a gap, what I felt like was a gap in
mhm,
infertility training and understanding. And a lot of perinatal therapists who like were colleagues and just in various professional consultation settings that I've been in have questions or have clients that they see, like, who
mhm,
didn't seek help until they were postpartum. And then these therapists are like, I don't know anything about infertility. Like, does anybody help me with this? And so it's not their primary focus,
mhm.
but it is something that they absolutely will see if they're working in this space. And
Right.
so they may not have the capacity and the financial desire and time to commit to all the tons of training that I did. Um, and so I did create a training myself that I host and facilitate on infertility for perinatal therapists. And it is
Great.
approved for advanced training through PSI as well for the certification. That does give, an introduction and helps educate perinatal therapists, specifically and birth workers, on like, what the basics of what you need to know in working with this population. Um, and
That's
that's been really
fantastic.
rewarding. I anticipated that like people who were not certified were going to be coming to participate because they need the certification hours. And I've had mostly people who already have their certification who've attended my
Mhm.
trainings, and really good feedback about the impact of, the clients that they're seeing and the work that they're doing.
That's fantastic. Yeah, I really that's something I appreciate about people who like want to further their understanding and deepen their knowledge and it just always it helps you as a clinician, me, us, but it, helps our clients so much too. And, just a little bit more, even, even if it's not like your primary specialty, so to speak. Um,
Yeah. And that's
it's,
it. Like people who this is not their if you have a desire to have this as your primary specialty, I strongly encourage all the trainings and all the things that I mentioned earlier. But if this is not necessarily your primary thing, I think you absolutely still need advanced training and education
Mhm,
because you will see it. Whether you anticipate it or not, you will see it. You may have people who have chosen to use an egg donor and are coming to you in the postpartum period and having a hard time with adjusting to
mhm,
having an egg donor or having a baby now who is maybe, a different race than they are and like how they're
mhm,
adjusting to that, how their family is. So you will see it as a perinatal therapist.
mhm,
You will see people who are pregnant and like super anxious and like
mhm,
traumatized maybe from some fertility treatments and experiences that they've had. You will see it as a perinatal therapist. You will for sure
mhm,
see people who have
mhm.
it.
Yeah, thanks for speaking to that. It's really just so important, to name that.
I think what's also important to kind of just to mention and name as well is that there's a lot of people in the reproductive space who are birth workers, who are physicians, who are nurses, who are front desk staff, who work at fertility, work at OB clinics, who are also simultaneously experiencing infertility. And that is a whole different challenge and experience. I have several people that I've worked with who've been in those spaces. And, I think it's just something important to also note that, like, other therapists who may be experiencing infertility are on the road to having their family.
Mhm,
In that journey and the uniqueness of that journey of having to kind of serve folks who are pregnant, postpartum, or also simultaneously going through infertility at the same time, and what that experience is like as well.
wow, it's super hard. There's That's really challenging, and there's something that I so appreciate about therapists and people in the helping profession is that a lot of people can still show up for their clients and for the people that they're supporting, even with when they're silently suffering.
Yeah, yeah, for sure.
It's sort of amazing that people can like develop that and be able to do that, while it's so painful for them personally.
Yeah, yeah, for sure. I think what I would say, to someone else is navigating this journey. I think sometimes you feel like, when you see people like myself, talking so openly and advocating and doing a lot of things on that front, it can kind of sometimes make you feel like maybe I should be doing those things or I should be sharing my story more. I should be talking about this more. And I do really just want people to know that like everyone's journey is unique and it's their own. And when I was in the thick and in the mud of infertility, I could have never shared. I mean,
Hmm.
even a few years ago when I first shared publicly my story, there were still pieces that I didn't share out of
Hmm.
respect for my relationship, in my marriage and my husband, because it's not just my journey, it's
Hmm.
ours.
Hmm.
Um, and thankfully he's fully supportive now. And I mean, he's always been supportive, but he's open now as
Right,
well.
right. Yeah.
And so like I couldn't imagine doing the things that I'm doing now while I was going through this.
Hmm.
So I hope that people don't walk away feeling like that or think that that's what's needed.
Hmm.
And that people just also know that like you don't have to go through this journey alone. Like
Hmm.
there is professional help. I mean, of course, I see folks in DC, Maryland, Virginia, and Georgia.
Hmm.
But if I'm not in that area, there are folks who are trained. Resolve has a directory. ASRM has a directory of professionals who are trained in infertility. And there is hope and there is support out there. There are plenty of support groups. That's something else that I utilize with a support group,
Hmm.
and had like a really hidden secret name on some of those threads because I was so scared of someone finding out. Um, but that there is support out there, there is help out there, and folks don't have to go through this alone, even if you're not comfortable sharing with people in your personal life.
Thank you so much for saying that and for being here and sharing your story and the work that you do.
Yeah, you're welcome. And thank you so much for having me and giving opportunity and space for this topic.
Absolutely. You can connect with Shatiera at seedsofhopecc.com, on Instagram, Seeds of Hope CC, and on TikTok, Seeds of Hope Infertility. And if you would like to attend some of her trainings, there are a few coming up, both in person and virtual. In person in the DC area, Sunday, July 28th, and virtually on August 9th, 2024, and September 8th, 2024. And her approach to therapy and to training is informed by her own personal experiences with infertility, but also professionally backed by extensive training in fertility counseling and perinatal mental health. And that is what is so important. We share this episode and these resources far and wide. We know in the field that infertility and infertility challenges play a huge role in our mental health and wellness, and can have devastating impacts going through the process without having adequate support and not being understood by your providers. So it's really important that people know, first of all, that this is a specialty in perinatal mental health that they can get more training in. But also, people who are going through infertility can meet with professionals who know how to support them. It's very, very important to make sure that people are paired with the right therapist who has adequate training in the issues that they're seeking help for. Thank you for being here and joining in on this episode. Until next time.